Okay, at 7:45, the CDC warns people about a parasite that can live in a pool for days. Dr. Richard Chaffoo is here to explain more about it. Well, first of all, happy 4th of July
Happy
to
4th,
you.
Kristina.
Okay, so let's talk about this because I feel like a lot of people are going to head to the pools today.
Exactly.
And you're talking about this parasite that's causing certain problems. What is this parasite called?
So it's called cryptosporidium, or crypto for short.
Okay.
Sort of a tongue twister.
Right. And what is it? What's going on?
It's a parasite, Kristina, that lives endemically within our environment. So it's something that's not necessarily a pathogen or causing an infection. It's typically something that's spread through kind of what we call a fecal-oral contamination. Ooh. So it's found in the intestines.
Okay.
And it can cause some serious symptoms, even in relatively healthy people being exposed to it.
Okay, and when you say endemically, and we're talking about the pool, you're saying that this parasite can survive in with chlorine?
It can survive with chlorine, with certain chemicals. And so the important thing is you want to make sure that you instruct your child about, not swallowing water. Interestingly enough, just swallowing that water is enough to get that parasite into your GI tract and causing symptoms. The symptoms are delayed usually 2 to 10 days before you actually become ill.
And what are those symptoms?
So the symptoms are typical sorts of GI symptoms. There's nausea, there's vomiting, watery diarrhea. The child or adult certainly can have a fever, can have abdominal pain, and if the symptoms go on long enough, Kristina, you can have significant weight loss, malnutrition, electrolyte disturbances, and in the very young and the elderly, this is where they've gotten into trouble. Most recently there were 200 cases of hospitalization and 1 death, so it's not entirely a benign disease.
And who is most affected? Is it children?
It is most often the children, but then also adults and the seniors. For older people, not elderly, but for adults, you might just kind of brush it off. If it's your older child or an adult, well, it's just a viral illness. They were sick for a few days, but certainly something like this can go on for a couple of weeks.
Okay, and the only and this is concerning, if we want to call it that, because you say that there's been an increase.
There has been. If you look over the past 10 years, there's been a 13% on average increase in crypto per year. So it's become a much more significant health risk.
Now, is it only the pool that you can get this parasite?
No, you can get that not just from a pool. You can get a contamination, like for instance in daycare centers, where say a child who's ill, who's having some diarrhea, ends up being taken to the daycare center. Can actually occur around barns and livestock, just from simply stepping in some of that stool and actually bringing that into the home and getting onto cooking surfaces. So it's very easy to pass this along to someone.
And like you said, it survives.
It survives. It survives heat. It survives chlorine and chemicals. So it's a very hardy organism. That's why it exists endemically in our environment.
And that's what I was asking. I was like, is this just the pool that we're talking about? Are we talking about jacuzzis and hot tubs? And you're saying yes.
Yes, all the above, definitely.
So now here's my question. So as a parent, now I'm a little concerned.
Of course.
Or even I am a little concerned.
Right.
What can people do to protect themselves? What do we need to do before we hop in or jump in the pool?
So I think the number one thing about any illness is awareness. And number two, if your child is ill, keep them out of the pool. If they're having lower GI symptoms, keep them out of the daycare center. And then obviously washing hands frequently, but especially using soap and water, because unfortunately sanitizers do not kill crypto. And then if you're going to be around like barnyard animals or livestock, make sure that whatever shoes you wear in that environment, you leave them outside so you don't track anything into the house.
Smart. Okay, so the antibacterial does it. You've got to wash your hands with soap and water.
Soap and water.
Important.
Very basic.
And we've been talking a lot about this, especially after what's happened with the county fair.
Right.
So, okay, Dr. Chaffoo, thank you so much for being here.
My pleasure.
Okay,
Kristina.
happy 4th to you.
Happy 4th to you too.